Hello, my name is Yamaris, and today I'm going to talk about the Alzheimer's disease. What is the Alzheimer's disease? The Alzheimer's disease is a progressive disease in which the brain degenerates slowly until reaching the dementia. In other words, the neurons of the brain are going to get damaged and then they will die. What is the cause of the Alzheimer's disease? The cause of the Alzheimer's disease are by genetic defects, family inheritance, or by the reduction of the neurotransmitter acetylcholine that will causes damaged brain and its functions. What are the symptoms of this disease? The symptoms are memory loss, confusion and difficulty in language, difficulty in reasoning and thinking, difficulty in inability to make decisions, inability to do essential tasks like dressing, eating, cleaning, and change in behavior and in personality. The person will be more isolated and aggressive. Diagnosis. Doctors can perform a few tests like physical and neurological examination through coordination and balance tests, blood tests to rule out any possible conditions that are related with the memory loss, neuropsychological analysis to identify how the mental function is, MRI to help remove other brain disease, CT scan to eliminate any tumor or lesion. To diagnose or identify the Alzheimer's disease, the doctors perform the 18FFDG PET imaging that shows where the nutrients in the brain are acting in an inappropriate way. When there's a low metabolism of nutrients in the brain, that will cause the brain to deteriorate, and the doctors can identify this disease. In this picture, you see the healthy brain and the Alzheimer's disease brain. Treatment. There is no cure for this disease, but there are some medications that help improve the symptoms of the Alzheimer's disease. The first medication is the cholinesterase inhibitors, help increase the eight stages of cellular communications that possess a chemical messenger that is terminated due to Alzheimer's. Metamine helps delay Alzheimer's symptoms. Antidepressant helps to improve the person's behavior and depression. How this is related to the class? It's related to the class in that the professor discussed a topic weeks ago about the nervous system, specifically central nervous system. And this disease affects the central nervous system. The parts of the brain are limbic system, cerebral cortex, thalamus, hypothalamus, cerebellum, brainstem, midbrain, pons, and medulla oblongata. It affects the limbic system because it affects the emotions, the mood of the person, and how memory process changes. Cerebral cortex because it will affect the awareness, communication, and memory storage. The thalamus will affect the transmission of messages to and from the brain. Hypothalamus will affect the physical responses to emotions and the perception of feelings. Cerebellum will affect the coordinated movements and balance. Brainstem, like I said, will affect the midbrain, pons, and medulla oblongata because this disease affects the reflexes of the person. Here is a picture about the brain of a human being. Why are you interested in this topic? I'm interested in this topic because the Alzheimer's disease is the fifth most common disease in the elderly. In addition, because people are most afraid of this disease because it affects the memory and your skills. It makes it difficult to do basic activities like dressing or eating, and there is no cure. Here is another picture about a healthy brain and Alzheimer's disease brain. The brain is shrink. This disease shrinks the brain. Current research. Alzheimer's researchers found results of a new drug that could help Alzheimer's patients, pimavanserin. These drugs will serve as a procedure to delay brain damage in people with Alzheimer's. Also, there's another drug, aducanumab. that it will help people with mild deterioration and anticipated dementia to obtain an improvement in the mental and in the brain. Why is this important? It's important because it is a disease that affects your brain, your mental and physical functions. It changes completely, making you another person unable to take care of yourself. Also, people with Alzheimer's need proper care and attention to avoid injury. Alzheimer's will reach a point where it will damage the brain and the person will not have the ability to perform basic tasks like eating, dressing, and I want some conclusion that I want my audience to have on this issue is that this disease is a very serious and common one. If they have a family member who suffers from it, they should be understanding and help them. This disease causes the person to change their mood, be confused, and have no memory. So if they see someone in the street that has Alzheimer's or have these symptoms, please help them to avoid an injury or accident. Here are my resources, and I hope you like my presentation. Thanks.